Now I hold the hard anatomical bony structure, which we call pelvis. Anatomical structure, bony structure, which we call pelvis, it contains two pelvic bones, right and left, which is connected to each other by symphysis of pubic bone. And posteriorly we have the sacral bone, which is connected with that. That's a sacral bone with two right and left pelvic bones together forms the skeleton of the pelvis. We studied together before the sacral bone. Now we will study the pelvic bone. That's a pelvic bone. I will take just one, right or left one. If you remember in my lecture I say you that pelvic bone in fetal part or in childhood first years, it is not one, but it is three bones, which is connected to each other. Then, for adults, these three bones fuse to each other, and they form one hard pelvic bone. Where is these three bones, my friends, and how they connected to each other? All these three bones connected to each other in the place of the hip joint. Look here, please. All these three bones connected to each other here. It is great visible in the picture. Look here, please. You can see that between three bones, this is one bone, this is second bone, this is third bone. Between these three bones, inside of our joint depression, forms the connection. By the way, my friends, this depression we call acetabulum. Acetabulum, remember please. Now, which bones connected to each other in the place of acetabulum? Superiorly, the biggest bone which you see, we call os ilium. This is os ilium. Or we say iliac bone, os ilium. Inferiorly, you can see two bones. One is located posteriorly, second is located anteriorly. Posterior bone we call ischium or os ischiaticus. Anterior bone we call pubic bone, os pubica. Let's say, my friends, let's come to conclusion that our pelvic bone has three compartments. Once again, ilium, ischium, and pubica. This is ischium, this is ilium, this is pubica. And you can see that these three bones forms connection to each other in the place of acetabulum, in the place of the joint. Now let's describe each one. I'm sorry. Let's start from the ilium. And let's describe all these bones. Now 1 minute attention. Iliac bone has several important compartments. Superior part of the iliac bone we call the wing, ala, wing, like the bird wings, wing of the iliac bone. Superiorly, my friends, to the wing we have the crest of iliac bone, crista iliaca. On the iliac crest we have 4 spines. 2 spines located anteriorly, 2 spines located posteriorly. How we call these spines? Anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine. Let's say, my friends, from these 4 spines, you can palpate in your body only one. This bone which you palpated just in the place of your belt, it is anterior superior iliac spine. Let's say it is great palpatable. By the way, my friends, from anterior superior iliac spine, our inguinal ligament is started. Inguinal ligament, it is border between our abdomen and lower extremity. Let's say, remember once again, the wing of iliac bone, it has crest of iliac bone, and crest has 4 spines, 2 located anteriorly, 2 located posteriorly. Anterior superior, anterior inferior. Posterior superior, posterior inferior. Great. Our wing has 2 surfaces. One is look to inside, it is inner surface. Second, look to outside, it is outer surface. Let's say, remember please, wing has 2 surfaces. It is the outer surface, which is look to outside, and it is inner surface, which is look to inside. It has the place of articulation, my friends. You remember, yeah, which is connected with auricular process of our sacral bone, and it is located in the inner surface of the iliac bone. Let's say, friends, 1 minute, I will turn it. Great, it is inner surface, and you can see it here. This is the place of joint, place of articulation of our sacral bone. You can easily see in the right and in the left. Let's say between sacral bone and between our iliac bone, the joint will be formed. If you will look inside, my friends, you can see the crest of iliac bone, spine, sorry, of iliac bone, which is located inside. We call it linea terminalis, and it is located just on the inner surface. Look, so that it's visible. And it is divided wing of our bone from the body of it, which is formed the acetabulum. Let's say it is linea terminalis. By the way, linea terminalis, it is important landmark for the surgeons. Up to linea terminalis, we have big pelvis. Below the linea terminalis, we have small pelvis. Let's say, remember, please, in the future, then we will study the cavity. We will say, for example, big pelvis, small pelvis. Border between them will be linea terminalis, which is located in the inner surface of it. Let's continue very quickly, because my time is very short. Now I will show for you all the bones, and in the next lesson we will speak more about them. By the way, in which time we finish? How many?
3 minutes.
2-3 minutes? No, it's not enough, but I will try to give you. Now, os ischiaticum, my friends, just the most important structures. It is tuberositas, os ischiatica. Look here, tuberositas, which is look to the back. It is our gluteal region, tuberositas os ischiatica. It is place of attachment of big muscles, of musculus gluteus maximus, for example. Yeah? And in front of it, my friends, you can see the pubic bone. Pubic bone has 2 branches, superior branch and inferior branch. Between superior and inferior branch of pubic bone and os ischiaticus, you can see aperture, which is formed, we call it foramen obturatorium. Foramen obturatorium. It is located anterior. Foramen obturatorium. Why obturatorium? Because 2 muscles will be attached here. Musculus obturatorius externus, musculus obturatorius internus. These 2 muscles attach to it and close this aperture. Then we will study after lower extremity. Many times we will speak about this aperture, because obturator vessels and nerves pass through this aperture. And we will describe them. And finally, last structure, which I will show for you, it is symphysis of pubic bone. It is connection between right and left pubic bones, which is formed by the cartilage. Symphysis os pubica. All another important structures, all another peculiarities which we must to know, we will discuss together just in next hour lesson. Questions?